Good morning, everyone. It is Thursday, November 4th. Welcome into the morning medical update, and thank you for joining us on YouTube, Facebook, and on our podcast. The CDC has given the official go-ahead to vaccinate those children ages 5 to 11. What will the rollout look like? Where and when can our kids get the COVID shot? Here are some of the first kids in the country to receive the EUA-approved Pfizer vaccine. But to get to this point with these kids, you need kids like this. We want to show you 8-year-old Andrew, who participated in a Moderna trial for children. His parents join us in studio today. They themselves are physicians. Their child, their family stepped to the plate. What the process was like for their family. We're going to talk about that. Plus, Dr. Kevin Ault, who sits on the CDC's ASIP committee, joins us with what was discussed, how this approval will affect overall infection rates. We'll have lots of questions for him this morning. So make sure to get your questions sent in to us via YouTube, Facebook, and on the Medical News Network. You can find links to those right there on your screen. But first, we want to get to Dr. Hawkinson joining us with our numbers this morning. How'd we do overnight?
Yeah, I mean, we get these little teases. So we've been bumping up and down. And again, I think it's more important just to look at the overall 7-day, 10-day average and what those numbers are, and not necessarily the day-to-day blip. But right now we have 13 active infections with 2 ICU patients, and those 2 ICU patients on the ventilator. We still have 24 patients who meet that recovered criteria, so 37 total. But we should say that Hayes has 12 active infections and 4 in that recovery period as well. So they are still at a fairly high capacity for their active infections out there.
Well, we talked about this a little bit yesterday when Dr. Stites was here. I want to show you something that was sent in to us. Really, we're going to show this as a reminder that we often feel like the numbers are low, deaths are still occurring. While it feels like COVID is going away, COVID is still here. We just simply need more and more people every single day to get their vaccine, start thinking about getting their vaccine, start thinking about those questions that they need answered to get off the fence and get protected. So thank you for sending that in as that reminder this morning. But before we get too far into our conversation, do we have any reporter questions on the line this morning?
Hi, Jordan from Channel 41. I have a question for Dr. Hawkinson. Do you know the percentage of employees at the health system that is complied with the vaccination requirement? I know St. Luke said the other day they had 99%. I was wondering what your number was at the hospital.
I don't have those numbers off the top of my head. I can try to get them for you, and we can go from there.
All right,
okay, cool.
Jordan.
Are you seeing what? Sorry, just one last one. What hesitation do you see with your frontline workers, maybe hesitant about getting the vaccine, or are you answering questions daily from frontline workers about it?
You know, we've had several town hall presentations and question and answer sessions, large town hall for the health system, but also specific areas or departments. You know, a lot of questions that we are asked continue to be about safety, of which, you know, the vaccines are very safe. Also, infertility. We know that there are no infertility issues or problems with these, but those really are the most common. And then, of course, there are other medical reasons that people are looking at, some of their past experiences, things of that nature. And then, of course, other exemptions that we are looking at as well. But the questions that we're getting mostly revolve around the safety and, of course, things like infertility.
All right, Jordan, thank you. Donna has a question from Channel 9, wondering what you think, Dr. Hawkinson, about the breaking news this morning that Britain has authorized use of Merck's coronavirus antiviral pill for adults 18 and older who test positive for COVID-19. What you think about it, but also do you see this as a positive step in throwing everything at the virus? And would this be something we might see here in the U.S.?
Yeah, I mean, I know that we are looking at it. Our FDA is looking at it. And then, you know, once they review all that and say it's okay, I think it will be interesting. It is, of course, an oral pill that you take. I think it will just be overall interesting to see what happens with cases and hospitalizations based on that. So I think there's a lot more questions for that, for me, compared to getting the vaccination. You know, it's kind of strange people would want to take this drug that is really fairly new. But it looks safe. Again, it's been in development for years. This is a known drug. It didn't just come out this past year, or wasn't just discovered. But, you know, it is new. So I think it'll be really interesting to see how that works and how that plays out in the UK, and we'll go from there. Certainly, we know the FDA is continuing to look at the safety profile and all of the evidence that we have so far from all the trials and all the information that we have. It does look good, and as far as good, it does look effective in helping reduce hospitalizations and does look safe as well. And again, all that is available on the FDA websites and other publicly available websites. But I think it'll be interesting to see what happens with the infection dynamics in the UK now that they have approved it. So we'll just wait and see.
All right, other questions on the line? Okay, we are going to get to our community questions here in just a moment. So again, a reminder to get those sent in to us. But let's get to our topic. Some 28 million American children have been authorized to get the COVID-19 vaccine. But to get where we are today, it took children participating in trials. This morning, we talked to the parents of one of those young participants who took part in the Moderna trial. While that vaccine isn't approved yet for children 5 to 11, he is playing a big role in making that happen. So joining us this morning are 8-year-old Andrew's parents, Dr. Sarah Selby, who works in the emergency medical department, and also Dr. Luke Selby, a colorectal and oncologic surgeon here at the health system. How are you both doing?
We're doing great. Thanks for having us.
Good. How's Andrew doing?
Andrew's doing great. So he got the vaccine. Or we should say we found out last night that he got the vaccine, but he had his first shot in the middle of August and his second shot a month later in the middle of September. This photo here is right after he got his first shot. Both Sarah and this is the second shot, both Sarah and I and every friend we have in medicine took those triumphant selfies and posted them all over social media when we got vaccinated. Andrew saw those photos and demanded one for himself.
He was really proud.
He was super excited.
I want to talk more about Andrew. I also want to welcome in Dr. Kevin Ault. He is one of our OBGYNs here, but also a member of the CDC's ASIP committee. We have been waiting to catch up with him this week on the CDC's latest recommendations. So we're going to talk with Dr. Ault here in just a moment, but just want to talk with both of you as parents about what went into your decision to enroll Andrew in this trial. I mean, we know you're physicians and you've vetted out the vaccine, but just as a parent, talk to me about that decision.
Yeah, so I think one of the important parts is that both Sarah and I are physicians. So Sarah was one of the first 28 people in the state of Ohio to get the vaccine the first day it was rolled out, and I got it as soon as it was available for me. We felt very comfortable that it was safe for adults, and we felt very comfortable that it would be safe for children, but the way you find this out is by doing research. And when I'm wearing my doctor hat, I ask my patients to enroll in clinical trials almost every time I'm in clinic, and it only seemed fair. We had a question that needed to be answered by a clinical trial, and I should put my parent hat on and talk to Andrew and get his permission to enroll in the trial, and that he gave it to us after we explained it.
Just like he was a patient.
Exactly. He didn't have to sign consent because he's not old enough, but he had to sign a permission slip giving his assent to do it.
So Mom, I have to ask you, what was that question like with Andrew? Or what was that conversation like? Did you just say, hey, you have this opportunity? Was he wanting to learn more? Or was he like, no, I'm stepping up to the plate. Let's get this done.
So he was very excited. So any kid right now kind of knows what's happening with COVID. It has changed their lives. And he was very excited to be able to participate in this and go to school knowing that he might have gotten the vaccine, so that he's one step closer to potentially getting back to normal. So that was, for us, that was great. And he understood that we were some of the first people to get the vaccinations. We were treating patients. We were talking to him about what we were doing at work. And he was able to understand a lot of this. So he was really excited to participate in this. And
so it was a family affair, I think.
It was.
Kind of in the blood.
Yeah.
He saw Mom and Dad
Exactly.
doing it, and he wanted to do it too, right?
Making history.
That's right. So a question people have about a lot of parents, again, I talked to you about as doctors, but I'm talking to you as parents a lot today too, because parents, as they're making this decision, want to know, are there any side effects at all? We know there's no major side effects, but did you notice anything with Andrew during this time that he was enrolled in this trial? What was it like? What did he feel like?
So he was a little anxious just because he had to hear about everything that we were doing for the trial, but he was very excited and he did really well. So he got his vaccination just like he would any other vaccine, any flu vaccine. So he did really well. It was a simple little pinch and he got a great Band-Aid. So he was excited. The next day his arm was a little bit sore and swollen, but that was about it. He acted totally normal. He did everything else like normal. He never had a fever. He acted like it was just a normal vaccine that you would get typically.
Okay, so we were talking before we started this morning. So Pfizer is EUA approved. Moderna is not yet. He participated in Moderna, but because he did receive the vaccine, he is now officially vaccinated?
Yeah, so we're assuming, we know the Moderna vaccine is incredibly effective for adults. I have no suspicion that it's not going to be incredibly effective for kids. So we're considering him fully vaccinated now because Pfizer's EUA approved. The Moderna trial allowed us to find out which arm he was. There was a 75% chance that he was going to get vaccine and a 25% chance he was going to get placebo. We found out last night he got vaccine at his basketball practice. I told him after, and he got like a 10,000 watt smile.
Oh, really? Okay,
Yeah.
and then you have another younger child who's going to be getting vaccinated this week, right?
We have a 5-year-old Jackson who at Monday afternoon is getting vaccinated and is going to get his flu shot at the same time.
Does he share the same enthusiasm, I have to ask, about
Yeah.
getting the shot? Because I have a 5-year-old and he's not as on board as my 8-year-old.
Well, so he's not excited about getting a shot,
No.
and he's probably going to be less excited about getting two.
Yeah.
But he was really excited to see Andrew going through this whole process. And Andrew's actually, when I told Andrew that he didn't have to get the Pfizer shot because he got Moderna and our expectation is it's going to be effective, he said, but I'm going with Jackson to help Jackson. And
Right.
so they're excited. The trial we were in was up in Omaha, and we drove up as a family for Andrew's visits. Jackson got to go to the zoo, so that worked out great for
Yeah,
him.
there you go.
But Jackson saw what Andrew went through and is excited, and he'll get a cool sticker and some cool Band-Aids and a lollipop afterwards. And
Done
that'll
and
be
done.
that.
It goes a long way, doesn't
Right.
it? All right, Dr. Ault, I need to bring you in here. How are you doing this morning? Thanks for being with us. I think you're on mute.
Oh, it doesn't say I'm on mute. Can you not hear me?
I can hear you now. Yep.
Okay,
How are you doing this morning?
good. Thank you.
So, earlier this week, we talked about how they were looking at some possible heart issues with the Moderna vaccine. Can you tell us a little bit about that? We're getting some questions about that.
So for both of the RNA vaccines, we've seen a rare side effect, mostly in boys older than the two boys we're talking about earlier, late teen boys with myocarditis. And the rate is about somewhere between 1 in 50,000, 1 in 100,000. So it's certainly not very common. If you listened in on Tuesday, our consumer representative, Ms. McNally from Michigan State, said, is it more common to have myocarditis from COVID or is it more common to have myocarditis from the vaccine? And the unequivocal answer was you're much more likely to get myocarditis from the COVID virus than you are from the vaccines. Plus, what we know about the vaccines, and we talked about this extensively on Tuesday, is that the myocarditis is relatively mild and there's full recovery. So we are seeing this rare side effect in a group of mostly males, but also females that are a little bit older than the 5 to 11 group. In the trial that was done of 4,000, 5 to 11-year-olds, we didn't see any myocarditis, but you wouldn't expect to see that if it's 1 in 100,000. So we'll have to get more data. We've talked about this. You could listen to dozens of hours on YouTube of us talking about this. And so, so it's an evolving story and we're going to keep talking about it. It might not get in the news as much as it does when we first approve it, but we keep talking about these issues over and over again.
So, what can you tell us about the next steps in the process of getting other vaccines approved? We have Pfizer now approved for 5 to 11-year-olds. Andrew participated in this Moderna trial. What are the next steps?
Well, they have to have efficacy data to present to the FDA. They are the company, Moderna, and they usually would have 2 months of efficacy data, and then again later on they'll have 6 months of efficacy data that you'll hear about if you pay attention. But that first batch of data is usually what makes the news. So if children were getting vaccinated in August, you'd think that data is coming up pretty quickly, and there'll be the FDA hearing, and then after the FDA hearing, they will come and talk to ACIP, and again, we're expecting that. It's like reading tea leaves, but you would expect that in the next month or two, based on what our guests are saying, as well as based on what you hear in the news.
So we know that we're hearing some of these polls taken that there are parents who are quite hesitant. A large percent of parents that have been polled are saying that they're hesitant to jump at the front of the line to get their kids vaccinated. So when we hear this is approved, it's not just that it's approved and every parent is going to get their kid out there. We know that that's going to take time. But what impact do you think this approval is going to have as far as our overall infection rate as we get yet another group with shots, in their arms? How will this affect our numbers?
Well, there are direct benefits to the child that gets vaccinated, certainly as far as COVID goes. In that group of tens of millions of school-age children, there have been 2 million infections and 8,000 hospitalizations. And unfortunately, that group has the multi-system inflammatory syndrome at a higher rate than other children, that 5 to 11 groups. There are direct benefits to the child getting vaccinated, but some of the intangible benefits that we did talk about, there are a lot of pediatricians on the ASIP committee, was you don't have to take days off school if for illness or exposure, and your school's not going to get closed down, and life will get more back to normal. So there is some evidence that children spread COVID in school settings as well, in household settings, and so an indirect benefit of vaccinating that age group is less disease transmission.
Dr. Ault, if a parent is watching that is on the fence, hesitant, concerned, maybe even got the vaccine themselves, but doesn't know if they feel comfortable getting their kid the vaccine right now, what can you tell them? How can you reassure them the safety and efficacy of the Pfizer vaccine?
Well, I think the real nice thing about this is two of the most trusted professions we have in medicine, family doctors and pediatricians, are going to be the one giving out this vaccine. So people are going to pay attention to what their usual doctor says. And the AAFP, the family practice group, is located in Leawood, Kansas, and the AAP, is the other national group for pediatricians, have been very proactive about getting this vaccine, getting their membership aware of that. So, based on tens of millions of doses of these RNA vaccines, we know about the safety profile, and myocarditis is the main thing that has come up. We're going to keep monitoring that. And so the effectiveness was 91% in this trial. So it was very similar to what we found in the adult trials. And so, based on the data that we have, it looks very safe and effective. But as I said, we don't get in the news when we're doing all the follow-up. And of course, I'll be glad to come back on this show whenever we have a meeting. But, the follow-up is always interesting in a way because it usually follows what we knew at the beginning, but it's also boring because it frequently doesn't find anything, new or exciting as far as safety signals.
All right, we are getting a lot of questions for you specifically, Dr. Ault. We're going to get to those in just a quick minute from our community. But I just have to ask both of our doctors/parents here on the set with us. Just tell us the patients you serve, Dr. Selby, and how COVID affected the way you delivered patient care during this pandemic.
Yeah, so I'm a surgical oncologist, and what that means is I operate on patients with cancer. And COVID really affected my patients because as COVID numbers got higher, as the hospital had to decrease other things it could do in order to take care of critically ill patients with COVID, that meant it was harder for me to get my patients into the operating room. And it meant that our patients weren't getting their mammograms, they weren't getting their screening colonoscopies, they weren't getting into their dermatologists for full body skin exams. And I don't think yet we understand the impact that that's going to have. We know each of those screening modalities and many others either detect a pre-malignancy, something, or detect cancer at an earlier stage. And we don't know yet what the effect of people not getting their colonoscopy when they should have been is going to be. We're going to find out, but it's going to have a detrimental effect, not to mention patients who surgery got delayed or got canceled.
Dr. Selby, what challenges did you face? Your patients, you?
Yes, so I'm an emergency medicine physician, so working on the front line. So we were there right from the beginning. So I saw the very beginning when we were all scared of how do we treat this? What are we doing? Are we all going to be safe? Are we protected? I was there right in the front line. So I was extremely excited about getting this vaccine and then protecting our family as well as protecting myself, so that we can continue to provide care and learn more about this disease. And so it has affected every day of my work. I still love what I do, and I love answering questions for patients as to how we can go forward and when they have any questions about the vaccination. And now, we can say that we were some of the first people to get the vaccines, and now our son was also one of the first people to get the vaccines.
Pretty proud moment.
Yeah.
For the whole family. All right, we want to get to our community and get to some of their great questions this morning. Hey, Dr. Ault, Nancy has a question. Can you explain what exactly happens that makes the vaccine cause myocarditis? Why does that happen? You and Dr. Hawkinson can tackle that.
Why don't you let me go first, because I'm going to say I don't know, and maybe Dr. Hawkinson does know. But,
Good answer.
Yeah, so, when an event is that rare, it's really pretty tough to figure out, because if you enroll 100,000 people into a study and only one person has the condition, it's very challenging to find the etiology. As I said, I mentioned some of the epidemiological markers as far as the late teenage males and second dose, but, that's the peak age for myocarditis anyway, our late teenage males. And so I don't know. Maybe Dr. Hawkinson knows. I'll turn it over to him.
No, you're much smarter than I was. I was hoping you would know. I think the short answer is we really haven't elucidated that mechanism as to why that would happen. There is probably something to do with some sort of immune cells or immune the functioning and the chemical cytokines, things that are going on during that vaccine period. But again, overall, the mechanism for that really hasn't been identified or elucidated.
It's a tough thing to study. So,
well, you two are the smart ones, so I will take that answer for sure. Let's see. Okay, Dr. Ault, you're going to have to put on your OBGYN hat real quick because we do have a few questions about that today. Dr. Ault, have you seen the COVID vaccine? This is from Lindsay. Have you seen the COVID vaccine affecting women's menstrual cycles or ovulation cycles, altering them some for a short period of time at all?
There are some data that suggests that, and there's actually a biologically plausible mechanism. Dr. Hawkinson's just kind of mentioned one of them. There are immune cells in the endometrium, the lining of the uterus, and so they're affected by, being ill and getting vaccination. So there's definitely a potential biological plausibility there. However, one of the very first studies that came out showed that there were lots of irregular menstrual cycles because of pandemic stress. It just came out a few weeks ago, and if I remember correctly, it's from Northwestern University. So it's, again, that's going to be a hard thing to study because it's so common. There's so many other things that influence ovulation, the regularity of menstrual cycles. That's going to be challenging to weed that out. There is a biologically plausible mechanism for interruption of menses, but there's not really a biological mechanism for interruption of fertility. They're kind of two separate issues in my mind.
Dr. Hawkinson?
Yeah, and I would say that, certainly for the myocarditis, having those cell signaling mechanisms is plausible, but as Dr. Ault pointed out, it is so rare. I don't think that having somebody undergo a heart muscle biopsy for that, I don't think that the benefits would outweigh those risks of that issue. So that's the other thing to consider as well. That's one of the reasons why it is so difficult to study as well.
Okay, Isaac has a question. Dr. Hawkinson, as for those people who want to take the antiviral pill, not the vaccine, might it just be because of needle phobia in some cases? If that's true, how do we persuade them or make them more palatable?
Yeah, I mean, needle phobia, that's okay. Some people certainly have that. Although coming into the hospital and either getting blood draws or getting ECMO or IV lines, there's a lot more needles, bigger needles than there is in the vaccine as well. So, it's really difficult. People have many reasons not wanting to get the vaccine. But again, the best measure that we have is that preventive measure, and that is the vaccine. Anytime you get the infection, you do roll the dice with its complications. We do have some treatment now. The monoclonal antibodies are very good, but there is criteria to get those. We know that this pill is coming out. It is approved in the UK. The FDA is continuing to look at it here. But again, I think the main point is anytime you get this infection, you are rolling the dice. And this is a treatment, but it is not 100%. And we don't know how it will totally settle out once the dust clears, what the full impact will be as we get more and more people using it.
I was just waving at Dr. Stites. He was peeking in on us. Okay, so Andrew had no phobias of needles, I'm taking it.
Well, I feel like pretty much every kid does.
Yeah,
but
he's pretty darn brave.
He was getting to the point where he was a little more accepting. I mean, still with his flu shot last year, he was a little nervous about it, but it's over and done in just a second.
So he just had to, did he tell us a little bit more about the trial? You drive up there.
Yeah.
And
So we drove up there. The first visit was probably 3 hours long. We answered some questions about his past medical history. He got a full physical exam from the on-site physician, and then we agreed to enroll him. He agreed to be enrolled. And then behind the scenes, he was randomized, which is, we know for every 4 patients in the trial, 3 of them were getting vaccine and 1 of them was getting a placebo. That happened behind the scenes, and we certainly didn't know, and the people giving him the injection didn't know, but then it was thawed and they came in, and this is the shot of him getting his second, what we now know is a vaccine, but getting his second shot.
now looking at those pictures, you're going, wow, that's my kid getting the vaccine right there.
I actually, when you were showing the photos at the beginning of this, I got a little more emotional than I had expected I would. I mean,
Because you just found out last night.
Right, we
Your
found
kid's
out last
vaccinated.
night that, and this photo's 30 seconds after his first shot, and the hardest part for him was getting his blood drawn. That and the COVID test he didn't love.
Oh,
we
yeah,
had to
you're
have
right. I didn't think about that. Oh, those COVID tests are no good. I do not like that.
But he did really well tolerating them.
I
so
know, because
it's
he
really
knew
good.
that that's how you get to the end game.
Exactly.
Right.
I hope if anybody's watching this show and has anybody that's concerned or hesitant about having their kids vaccinated, I really hope that you send them here right now, because we have 2 of our physicians who trusted the trial. And what I like about this, because this is one of my questions I have for you, is that you didn't just throw him into a trial. Hey, you're going to do this, Andrew. You talked with him about it. You asked his permission, because I think that's something that people struggle with. And I know as a parent, I said, oh yeah, I was so excited to get when this came out. I can't wait to get my kids vaccinated, and they're actually going to get vaccinated tomorrow on this show. But I said, oh, wait a second. There's a difference between getting yourself vaccinated and driving another human being to get vaccinated when they don't totally understand, and maybe they're not totally making that decision on their own. And so, but I like what I hear you saying is that you really helped him understand that. We had
a ton of conversations with him about it, about why it was so important. And the other thing I would say is that, we're at a stage in life when almost all of our friends who went to medical school have young kids, and every physician I know who is a parent spent yesterday on the phone with their pediatrician's office trying to get the vaccine. Our kids have a pediatrician in Leawood, and I spent 15 minutes calling them yesterday, and it took 15 minutes because when I called, the line was busy. And then when I got through, I was number 50 in line to get the appointment.
That's a very powerful thing you just said.
Yeah. So the news is saying that there are parents who are concerned, and we should talk, we should talk about this being scary, but there are 50,000 things about parenthood that are scary. My kids bike to school. that's scary. Like the chances of them getting hurt biking to school has got to be as high or higher as the chance of them getting hurt with the vaccine. Certainly the chance of them getting COVID and missing school or actually getting ill is much higher. Nothing's a no-brainer decision when you're talking about your kids and everything is scary.
Yeah.
This was a pretty easy decision.
Wow, of all the things, this was one of your easier decisions. Dr. Selby, though, not every parent is a doctor.
Yeah.
Not every parent is married to a doctor. So you certainly have this advantage of that confidence. But what would your message be to someone sitting at home wanting to pick up that phone and call their pediatrician and go, wow, I'm gonna do this. I'm ready, but just has some hesitations. How can you talk to us regular parents that don't have the insight that you maybe have?
I would say that this technology has been around for a while and that it's very safe. It has been shown to be safe in adults, so it should be good for kids. So far, all the trials have been good and kids have tolerated it well. Our son tolerated it well, so I can tell people that they can do this for their kid. For us also, we're thinking about the future. We're thinking about kids going to school and being safe. And then also the holidays are coming up. So thinking about our family and our parents so that Andrew is protected, we are protected, they are protected, so that hopefully we can all enjoy the holidays and be safe together.
Okay, Lori has a question. And doctors, it is another myocarditis question. Could it be that is caused by the vaccine inadvertently going into the bloodstream?
I'll start and let Dr. Ault really finalize. But I would say, certainly we do understand and know that some components will be in the bloodstream. But again, it is such a small amount of material that is injected. Most of it is going to be taken up there in the tissues. The stuff that is not taken up right there in the tissues and those muscle cells is going to really drain to the lymph nodes through the lymphatic system, not necessarily the bloodstream or the such as the veins or the arteries. So I think that anything that does get to the distant sites of the body, any components of the vaccine, is going to be extremely minimal. And I'll let Dr. Ault see if he has any other thoughts.
Well, the only other thing I would say is that that's the reason we choose the deltoid, is there's no blood vessels there to hit. That's why reason we pick out the shoulder for that reason. So certainly there are shoulder injuries that go along with getting vaccinated, but it doesn't involve injection into the vein. And as you said, Dr. Hawkinson, the animal data where we experimentally vaccinate animals shows that the dose stays in the shoulder. So, I think we're really going to have to work on the mechanism of what's happening here. And, I feel bad saying that I don't know, but, we have international experts come and speak at the ACIP meeting, and they say the same thing. Basically, we got to work out the mechanism here. And Dr. Hawkinson alluded to that a little bit.
Anne wants to know, why did Pfizer add an ingredient used to stabilize heart attack victims in the vaccine for children? Wants to get her little ones vaccinated, and my mom is worried after seeing this article that's out there swirling around.
Do you want to go first, Dr. Hawkinson, or you want me to?
I'll let you go. I think you got an answer.
So
and then
I
I'll
saw this on
follow
social
up.
media too, and I'm not sure I understand the concern completely, but Tris is a buffering solution that's used in most vaccines, and the formulation of the pediatric vaccine is different than the adult vaccine for Pfizer and Moderna both, and so the Tris was added to the pediatric version, and that all has to go through the FDA and has to go through safety trials anytime you reformulate a vaccine. So Tris is in a lot of other vaccines. I'm not sure why this vaccine would be any different. I think the technical word the FDA uses for that is excipients, things that are supposed to stabilize or preserve the vaccine before it gets into the shoulder.
Yeah, all I would say is I completely agree. It's that Tris buffer, and from what I understand, it's also in many other drugs. It is in drugs that you put into your eyes, so eye creams. You're putting it into that area. So it is safe. And from when I read the FDA brief on that, the FDA information, mostly it was to help keep it stabilized at those higher temperatures. So maybe that refrigeration rather than that fully very, very cold temperatures. but it is an inert substance, and it's used in many different drugs, as Dr. Ault alluded to. And I think this is one more piece of information, number one, taken out of context, that is now supplying the misinformation campaigns. And it's really unfortunate that those people who are giving this misinformation are either doing it consciously or subconsciously because they just don't understand. But what they don't understand is the effect it has on people. I'm seeing a patient right now, mid-30s, with several children not vaccinated because of misinformation campaigns, and now these children are going to be without a parent because of these things. And those people really should start to be held accountable for that, because, again, we know the best preventive measure is the vaccination. And we do know and understand how many orphans now in the United States and around the world have been left because of this devastating disease. But we have this simple protective measure to take. So even healthy people can get severe disease and die from this virus. And it's important to continue to get healthy people, to get everybody vaccinated.
Dr. Ault, Kate has a question, and you mentioned it earlier about the amount of kids that were in the sample trial. She said around 4,000 kids is what she heard you say. That she said that feels kind of small. 4,000 doesn't seem like a lot of people in a trial. Is it?
Well, okay. It depends on your definition of small. If you've tried to run a trial that size, that's an enormous trial, and it's hard to keep track of all that data. The thing that's different about this is that we have tens of millions of doses already given to adults, and so we have a big safety background on this. And if I remember correctly, and I meant to look this up this morning before I got here, and it kind of slipped my mind, back in the 90s, we talked about how to design trials for drugs that were already given to adults, because many medications that were given to adults were just guesswork on how to be given to kids. And during the 1990s, there was, again, a congressional act and a FDA initiative to try to figure out how to give adult drugs to kids, drugs that have already been shown to be safe. And so I think that's the attitude. On the other hand, if you listen to the ACIP meeting or the VRPAC meeting, you're going to hear people like me say, I'd like to have some more data about that. We're never really happy in a way, because the reason we volunteer to be on the committee is we love data and we love analyzing data, so we're never really quite satisfied. So yeah, I would love to see more safety data on everything, and that's certainly one of the places where we're going to see a lot more data.
Dr. Selby, about how many people in a cancer trial?
So most surgical oncology trials, where we're deciding when to do chemotherapy or surgery, or if we're comparing surgery 1 to surgery 2, are done with hundreds of patients, not thousands of patients. So again, I talked about wearing my doctor hat sometimes and wearing my parent hat sometimes. Wearing my doctor hat, 4,000 people is a lot. And as Dr. Ault alluded to, running a trial with 4,000 people it sounds a lot bigger than reading a trial with 4,000 people.
Right, good point.
And we've definitely heard Dr. Stites even talk about with his cystic fibrosis patients, when they're looking at new drugs, a couple hundred people in a study, and they are happy with that. So the fact that the companies and the FDA have gone over and above what we normally would do for any other drug trial, I think, that speaks to that.
4,000 kids getting a shot? That sounds like...
Right.
That's a lot.
Right. And that's what's going to allow everyone to get back to school and, get back to normal. Everyone's wanted to get back to normal for 2 years.
And nobody more than those kids.
Right.
That's probably why you have so many willing to step up like that. Hey, Dr. Ault, Sandy has a question. My best friend had what her OBGYN said was a uterine immune reaction when she got her second vaccine dose. My friend said the pain was equal to childbirth, and she was anemic from blood loss. She will not get a booster now. What is the medical explanation behind this?
I'm not familiar with that term, but certainly if you have a disruption in ovulation or a missed period, a late period, an early period, they can certainly be heavier and make people anemic. Again, this is an active area of research, and because menses usually only happen once a month, you need a longer term trial to get the answer to the question you're asking. So but I've not seen that in my practice and my experience, but it's certainly biologically plausible thing that can happen. But again, there's a couple of dozen other things that we would, want to include in possible etiologies for that.
Kristen wants to know, I have heard that after getting the COVID virus, some pregnant women are having issues with their placentas. Seems like the virus is attacking it. Have you seen patients impacted by this?
Yes, so there's lots of bad news about this virus in pregnancy, and this may be some of the worst news because the receptor, the ACE2 and its receptor for the COVID virus is all over the placenta, and so there's a direct placental infection when women get COVID and the pregnant women get COVID. And so what you see is increased stillbirths and increased preeclampsia or toxemia and increased preterm births and worse newborn outcomes. So, and that's all because the afterbirth of the placenta gets infected. There was a nice study, an international study in JAMA a few months ago. And so, yeah, the placenta, is taking a hit here. And of course, that's the lifeline to the intrauterine child, the fetus. And so, and it's an active area of research, and the research also shows, I should mention this, that getting the vaccine protects against that damage. There was a nice article from Chicago a few months ago that showed that. So so the news about this virus and pregnancy keeps getting worse, unfortunately, the more we learn about it.
All right, couple more questions. Guys, can you roll the video that we pulled this morning of the kids, some of the first kids in the country getting the EUA-approved Pfizer vaccine? And Dr. Ault, I want to ask you just a couple things about that, because Joanne wants to know, is the vaccine for younger kids 1 or 2 injections? So will these kids with getting the Pfizer get 1 or 2?
It's 2, and it's a few weeks apart. I mean, the emergency use authorization, dictates that pretty strictly. So there's not a lot of wiggle room, although there's guidance if you miss the second dose and that type of thing. Those are called the clinical considerations, and the CDC will probably publish those today or tomorrow, I would guess. So stay tuned. There'll be information along that lines. But yes, it's 2 doses.
Okay, a couple more quick questions. Will kids need boosters?
Yeah, that's hard to know. I've said on the show a couple times, prediction is very hard, especially about the future. So, it's hard to know now. There's such great protection from hospitalization and severe illness in people that are fully immunized with 2 vaccines. The third dose has really been for, older people and people that are immunocompromised, and Dr. Shelby's patients with cancer. So, based on what I know now, I don't think that's a given. So, but we will find out.
Okay, more crystal ball questions. One more about when do you think kids under the age of 5 will be able to get vaccinated?
To some extent, one of the nice things about being on the ACIP committee is information comes to me in large volumes, but, usually you can hear about it in the press before I hear about it, with the big emails that I get. And so I would guess maybe in 2 or 3 months we'll hear more about that. But again, another crystal ball question, and I might be wrong in the long run. So we will find out.
Okay, couple more questions. Dr. Hawkinson, Holly wants to know, if a person is infected, does the viral load make a difference in the severity of the disease?
Are we talking about the viral load causing the infection, or the viral load you develop after that infection? I think there are different theories out there that the infectious dose of the viral load for you getting infected has something to do with it, but also some people say no. Certainly if you have a high infectious dose that you say you're walking right into somebody's cough stream or somebody's coughing in your face, certainly if you get infected with those viral particles and there's enough cells that are more infected and they have more of a effect on dampening that initial immune response, that could certainly lead to severity. But as far as what happens with the viral load once you're infected, I'm not really sure that there's necessarily a correlation there with severity of illness. The other correlation with severity of illness is certainly that inflammatory state after that normal viral stage. So good question, but I don't think we really fully know the answer to that.
Okay, last question is from Lori. She says, I am pro-vaccine, but I'll be requesting the provider to aspirate the needle for my son in case that causes myocarditis. Aspirating was previously the standard practice for vaccine. Why has it changed? Dr. Ault?
Well, I think I mentioned that before, and you could probably actually find a better answer on the CDC's website. There's not really veins and arteries in the shoulder. I frequently say, I want to bring a medical student with me to these sometimes for these basic questions, but, that's the reason we choose the shoulder. That's the reason we choose the needle length, that we choose for adults and pediatrics. So yeah, I mean, you can certainly get shoulder injuries from too deep of an injection, but that involves the joint of your shoulder, not the blood vessels.
But aspirate, just for people who don't know what that means, it's to pull the needle back. And
Pull back
is that
to
even
make
something
sure
you
you're
could
on the vessel.
request? Is that even something you would request?
Well,
And that's something they would do?
Anybody that knows how to give an injection does that, and it actually is a hard habit to break. So I wonder if people still do it, even though it's not part of the official recommendations. So yeah, I wouldn't bother me if somebody asked about that. So.
Okay. Dr. Hawkinson, we get that question a lot.
We
What are your
do.
thoughts?
Again, again, just as Dr. Ault said, the anatomy of that shoulder, the deltoid muscle, there's really not a lot of large blood vessels in there. That's why they're giving it into that soft tissue, that muscle, for that reason. I think if you wanted to ask the person doing that to pull back or aspirate, that's fine. But
the needles aren't like this long, aren't
no,
they? Just like
they're
what?
fairly short, yeah,
Like an
and
inch?
small caliber, yep.
Okay, I think we can handle it.
You'd have to be.
Yeah.
If I was giving a vaccine in the shoulder and I managed to get it in a vessel that's big enough where you would be delivering the vaccine into the bloodstream, I'd go off and buy every lottery ticket in the world because we
a good
talk
way to
about
put it,
we
yeah.
talk about being better lucky than good
So-
sometimes. That's like a 1 in 100 billion shot.
Never going to happen. This is
But
gonna-
if it makes you feel more comfortable, fine.
Okay. Well, just that it gets brought up. So I didn't know when now parents are going to flood to the clinics. Are they going to be asking this? And that's going to cause some issue, but it's doable if they want you to do
If
it.
that's what it takes to get the
That's-
vaccination,
Yeah.
Then
great.
go.
Come to me, I'll do it.
Okay, I like it.
We don't actually have the vaccine in my clinic. but we'll figure it out.
Not in
Okay,
your
no.
Oncology
Not
OR.
my oncology.
Yeah,
OR.
we're not going to send them to your door. Okay, so this has been a great conversation. I think you've helped a lot of parents' questions, people on the fence, and we know that again, those phones are going to ring off the wall, and that's good news. So, Dr. Selby, I'm going to let you just give us your final thoughts. What do you want parents to know about, Andrew, how he's doing, the safety of this vaccine, and the importance of it?
Andrew is doing great. So we're super excited to do this trial. Andrew is excited. We're all making history. This is all uncharted territory for us. So it's important to be proactive, think about yourself, your children, your family, but also think about other people. And so it's protective to you as well as everybody else. So I think that's our biggest message, is that we want to tell people that this is safe. He is doing well. He just started basketball. So he is active as ever and doing everything normal. And
Only
a normal
he's doing
kid.
it vaccinated.
Yes.
Exactly. He still wears his mask.
I was going to say, I bet he's a really good masker, and I
He's
bet he's
very
been
good.
a really good example to his friends at school.
Yes.
Yeah, if we ever make the mistake of getting out of the car with the mask buried in our pocket or something, we'll get like 3 steps from the car and be like, Dad, I don't have my mask. Sorry.
Sorry, I know
Yeah.
the kids are pretty darn
But
good at it.
they're, he's fine. Like, Sarah's actually, as a hobby, has made everyone in the family a bunch of masks, and the kids enjoy picking it out. I think they're going to enjoy, once everyone's vaccinated, when we can get to a point where it's safe to be in school in close proximity without masks. I think they're going to be fine with that.
Yeah.
They're not going to want to wear masks forever. But kids are resilient, and
And they don't care.
They don't care. They're troopers.
It doesn't bother them.
It bothers the adults way more than it bothers
Right,
the parents.
right.
Thank you for your insight. Just any other final thoughts you want us to know before we let you get back to work, and just the importance, and just a final message to parents.
I think the message is go talk to your pediatrician, go talk to your family doctor, go talk to your internist if you yourself are not vaccinated. I mean, The last time I heard the statistic, and I'm sure it's higher, is that over 97% of American physicians are vaccinated. I bet you in 3 weeks, if you did this, it would be over 97% of American physicians who are parents have gotten their kids vaccinated. It's hard to get 97% of American physicians to agree on anything. We argue about whether you should wear white coats or not. We argue about everything, and this is consensus in a group that looks really, really hard at the data when we're wearing our doctor hats, and looks really, really hard at the data and the safety of anything when we're wearing our parent hats. And that doesn't mean you should blindly follow us, but I mean, again, I don't know someone who...
It's good enough for me.
Yeah,
97%.
Trust us.
Trust,
Don't
yeah.
blindly follow.
right.
Absolutely. Dr. Ault, you played a big role in helping the CDC get to these recommendations. Just as parents, again, head out, start making those appointments. What do you want all of us to know?
Well, I was thinking this morning, we need to thank the Shelbys for volunteering to their time and, 2 or 3 hour drive just to get to appointments.
Yeah.
When we were starting to give the human papillomavirus vaccine as a clinical trial 20 years ago, we surveyed the volunteers when I was at the University of Iowa, and overwhelmingly in the upper 90s, the reason college-age women and high school-age girls were volunteering to be in our trial was so they could help other women. And this week, there's a publication in the Lancet that says, again, that these vaccines prevent cancer. So, we owe a thanks to those women who volunteered, 20 years ago when that vaccine was new. We owe a thanks to the Shelbys, for volunteering their time and going the extra mile to make sure we have this option available for kids.
Will you pass our thanks along to Andrew for us?
We will.
Absolutely.
Yeah, I thought he was going to be on the show. I was like, where's the littlest Shelby?
Oh,
He has to be in school.
Yeah, he's in school. We're doing this to decrease the number of days missed, and so.
Well,
Sorry.
that was my bribe for my 5-year-old. I said, "Do you want to go to school or do you want to go get the shot?" And he actually said, "I'll go to school." I was like, "Really? Okay, you really?" I told you I'm going to have to chase him around to get him. We'll see how it goes tomorrow. Dr. Hawkinson, both of your kids are vaccinated,
Yeah.
so another fully vaccinated house for you. So that's pretty exciting.
I would say, if you are over 50, go get your shingles vaccine. But if you have a child or a grandchild, as Dr. Ault said, please get your child the HPV vaccine. It can save their life. It can save them from devastation later on. I'm so thankful my kids were able to get it. Also thankful my kids were able to get the COVID-19 vaccine as soon as it was approved for that age over 12. So it's going to be an exciting time for children now to be vaccinated, but also we have some new information about the UK and the oral pill, hopefully to save hospitalizations. That's what we want to do. We want to keep people from going to the hospital, going to the ICU and dying. We want to keep our economy going. We want to keep our supply chains going. We know there's significant issues now with supply chains and things of that nature. Why? Because of this devastating disease. So but the best measure that we can take is to continue to vaccinate and get those people that aren't vaccinated or who are hesitant, get them vaccinated so that we can all keep everything going and especially keep healthy, especially for these next few months.
Yeah, and thanks, Dr. Ault and Dr. Hawkinson, for reminding people that there are other vaccines that they need to get to, because there's life before and after COVID. So thank you for that reminder. And thanks to everyone for being with us today. We are administering some of our first pediatric COVID shots tomorrow right here on the program. So we'll see how that goes. Hopefully they are as brave as Andrew. We're going to show Andrew pictures. This kid did it. You can do it. It's also follow-up Friday. Dr. Hawkinson and Dr. Stites will both be here, and as always, we'll answer your questions. So don't forget, you can watch our shows anytime on Facebook and YouTube. We will see you here tomorrow, Friday at 8.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.